Welcome, everybody. Hi, Kate.
Hi, Monica.
Welcome, and thank you for joining. It's 12 o'clock, so we're going to get started because we have a fun-filled hour with so much information to take you through. So let's talk about what we are going to be discussing today. Just want to say good afternoon, happy Tuesday, everyone, and welcome to our webinar today on skin resurfacing. We're delighted to have you all here as we delve into one of the most transformative treatments in medical aesthetics today. Over the next hour, we're going to explore everything you need to know about skin resurfacing, from its fundamental principles to advanced treatment strategies. But before we go through today's agenda, I'd like to quickly introduce ourselves. My name is Monica Puckering. I'm the clinical manager at SharpLight Technologies with over 15 years experience in the industry and laser technology. And of course, my lovely co-host here, Caitlin Anderson, who is SharpLight's senior clinical specialist and also has a medical background as an RPN. So Kate has extensive experience working in this industry and working with laser technology as well. So welcome, Kate. Thank you for co-hosting with me today.
Of course, I'm happy to be here.
She's like our fractional guru. So I'm very excited to have her here to really dive into the science of it all. So let's look at today's agenda with a quick overview of what we'll cover. So we're going to begin by defining what skin resurfacing is and fractional skin resurfacing. We'll then discuss the differences between ablative versus non-ablative techniques, highlighting their respective benefits and considerations. We'll then explore the unique advantages of an erbium YAG laser technology in skin resurfacing, including its effectiveness and safety profile. Then we'll delve into the science. We'll uncover how these treatments work on a cellular level to rejuvenate and revitalize the skin. And then we're going to go through some essential guidelines for optimal patient outcomes, focusing on that pre-treatment or before treatment care, preparation, and post-treatment care protocols. I think that's very important. We want to ensure we're following those proper protocols with such a unique type of treatment. And then we'll finish off with discussing the return on investment, so your ROI for your practice, and the benefits of combining resurfacing treatments for enhanced results. And then we'll wrap up with a Q&A session at the end. So if we don't get your questions during the webinar as we're going along, we will have time at the end to answer your questions live. So Kate and I will be able to look at that chat box and answer your questions. So feel free to pop things into the chat. We may not answer it right away, but we will have that time set aside at the end. So I hope that sounds exciting and you're excited to go through this next hour with us. So without further ado, let's get started. So first I want to talk about what is skin resurfacing. Skin resurfacing is a cosmetic procedure that removes the outer layers of the skin to reveal healthier looking skin beneath and encourage new skin cell growth. Now, today we're really focusing on fractional skin resurfacing. So this is an innovative cosmetic procedure that utilizes fractional laser technology to treat specific areas of the skin. Unlike a traditional laser resurfacing, which targets the entire skin surface, which I'll explain in the next slide a little bit more, fractional lasers create microscopic treatment zones, leaving the surrounding tissue intact. This approach promotes faster healing and reduces downtime. So I always like to just sort of like break it down first about what the difference between ablative versus non-ablative. This goes back to school, what we learn when we start out in medical aesthetics. So it's important to understand this concept to understand fractional skin resurfacing. So let's first discuss ablative versus non-ablative. So ablative versus non-ablative skin resurfacing are two distinct approaches that rejuvenate the skin. Ablative treatments involve the removal of the outer layers of the skin, completely removing like the epidermal layers. Typically, you can use lasers or even some chemical peels can be sort of ablative, but today we're talking about lasers. So this method is effective for treating really deep wrinkles, deep scarring, deeper dermal pigmentation, but the disadvantage is that it requires a much longer downtime because now you have removed that epidermal layer, and so your skin's quite exposed and vulnerable. On the other hand, non-ablative treatments use lasers or other type of energy devices as well to heat the underlying tissue without removing the outer layers. So something like your DPC technology would be non-ablative. This approach can stimulate collagen production, treat mild to moderate uneven skin tone. Non-ablative treatments generally have shorter recovery times and are suitable for patients seeking minimal downtime. They just require a few more treatments. So you can do a one-off ablative, but there's a lot more risk. And non-ablative, you might require a few more treatments, but you're having no downtime, none to minimal. Now, fractional. So fractional lasers can be ablative and non-ablative. So fractional ablative resurfacing, which is what we're talking about here. So our erbium YAG 2940 nanometer is intended for more superficial skin resurfacing. So we categorize it here as superficial fractional ablative resurfacing. So if you look at the image on the screen, we're looking at the second image here, which is what we're using at SharpLight. So fractional ablative resurfacing combines the aspects of both ablative and non-ablative approaches. It uses a laser that delivers energy in a fractional pattern, treating only a fraction of the skin surface at a time, leaving areas of skin intact. And that's what Kate's going to go into more in depth very shortly. But just to have an overall understanding first, this allows for a more deeper penetration to the skin while leaving surrounding tissue intact. So fractional ablative resurfacing is effective for treating and improving skin textures, wrinkles, scars. We're going to go through all of the list of indications as well today. And the key here is that it's with less downtime than these more traditional ablative techniques because you have surrounding tissue that's allowing for a speedier recovery. So choosing between ablative versus non-ablative treatments depends on the specific skin concerns, desired results, and the downtime tolerance of the patient. So at SharpLight, we use the erbium YAG 2940 nanometer for our fractional skin resurfacing because of its many advantages. Let's look at what those are. I love that video. I always want to dance. So why the erbium YAG? Because of the key points here, minimal downtime. We know, patients or your clients aren't looking to have 2 weeks off to ablate their skin and remove all skin concerns and have that healing process and have that higher risk of infection. So with minimal downtime, minimal side effects, like really easy healing. But Kate's really going to go through that post-care, what to expect post-fractional. And of course, that minimal risk of complications because we aren't removing the entire epidermal layer, which we know is the layer of skin that protects us from the environment. So if you are going into ablative treatments, your skin's very exposed, very vulnerable, and there's a higher risk of infection. But with fractional, your skin's still intact. You have those zones, those treatment zones that were ablated, but you have that surrounding tissue that's really helping speed up the recovery and protect your skin from the outside world. So that's really the key advantages and the why of erbium YAG fractional skin resurfacing. So I'm going to pass the mic over to Kate now to go into mechanisms of action, really diving into what those treatment zones look like, and really getting into the science of the skin and technology.
Thanks, Monica. This is great. So thanks for that. That's a really great introduction to learning about fractional. So essentially, the ERVM-YAG works at a 2940 nanometer, and it treats the skin with an array of those microbeams. So what she was saying earlier, where it creates a small spatial pattern on the skin in dot formation, rather than a large single dot. So with competitor different lasers and things like that, fractionated laser, instead of it ablating a full ablation of the skin, it only affects small little islets of tissue, which is ideal for wound healing and that shorter downtime. So it's going to affect those small little islets of tissue, and it can also help to create heat within the skin as well, because of the heat and inflammation that it causes during the treatment. But it does lead to shorter healing times because of the smaller areas of tissue that's affected. So the next slide will kind of show you that beam. So there's a little diagram here that shows you these small beams that it's creating. So with and how it works, the mechanism of action of how the laser does what it does is that it's attracted to the chromophore water. So when we're using different technologies, we're always looking at the differences between the nanometers and how it affects the different parts of the tissue. So this chromophore is actually water. So our tissue is made up of water. We know this. 60 to 80% tissue is made up of water. And at a 2940 nanometer wavelength, it's actually very attracted to the water in the tissue. And it actually activates an evaporation of water in the tissue and sloughing off those superficial skin layers. So the interaction couples with an array of those spatial dots. So you're getting those small wounds on the skin, and it results in an ablation and the superficial layers of the skin. And what's really interesting about fractional is it sounds, when you think of resurfacing, you're thinking about, a lot of skin coming off, but you can actually control how much damage or control damage you're doing to the skin, which is going to help stimulate cellular turnover. It's going to help stimulate your fibroblasts so that you can stimulate more collagen and elastin growth and better cell renewal. And so not only are we resurfacing and fixing the texture layers and the way that the cells are lying on top of the skin, but it's also helping at a deeper level, stimulating that collagen, which is going to give you a much better foundation on your skin. So yeah.
I think that's great, Kate, because I think a lot of people with fractional think
Yes.
that it's about the initial treatment that's removing, but
Yeah.
it's the key there is that the chromophore we're targeting is water.
Yeah.
And so it's a lot about the reepithelialization from the exfoliation, the turnover that we're seeing post-treatment, right? So all of that is
Exactly.
part of the treatment, is the post-treatment, how the skin recovers through the wound healing process.
Yes, and the other thing is, because of water in the tissue itself, if you have a more dehydrated skin that you're working on, you're actually going to have more peeling because there's less water in the tissue to start with. So that's something to keep in mind as well when you're treating your clients.
Yeah, because everybody will differ, right? So if your client's seeing more peeling, then Kate's now explained exactly why that might happen.
Yeah,
Amazing.
exactly. Yeah. So we have a lot of things that we can treat. There's a lot of indications, mainly the textural. It'll help with textural damage, so your fine lines and wrinkles. It can help with skin dullness. It helps with open pores because, again, you're dealing with new collagen and building a better foundation of your skin. So you're going to see a little bit of tightening in the skin as well. It can help restructure and remove stretch marks. It can help with sun and age spots and overall skin. So people who have this treatment can have, smaller problems. The beginnings of our anti-aging issues, where we start seeing those fine lines and wrinkles. Sometimes people just come to see me when they just want a refresh of their skin. It's a good preventative measure as well. I don't think people really realize that you can do fractional, and I'll explain a little bit later, but essentially we have different tips that will allow you to treat the skin more aggressively, less aggressively, more sensitive skin types, people who can tolerate a little bit more. So there's a lot more than just, okay, I've got a lot of issues on my skin. Let's just, go in, all in. We can take baby steps, or we can even, promote preventative procedure versus, treating it when it's already a problem. So that's something to consider as well. And the skin types for this, we can treat skin types 1 through 5. So that's your lighter skin tones to about, your darker brown skin tones. And yeah, that's pretty much it for indications. I don't have anything to add there, Mon, but.
Yeah, I think for skin types, just to note here, Kate's going to go through pre-treatment, and that's really going to be key with your skin typing. The fact that we can treat all the way up to skin type 5, but there's different ways we have to prep the skin for those skin types. But it is possible. So we really want to go through that today. So if you have questions after that about that, I think that's the most important thing, is how you're treating the different skin types with your fractional. But Kate, one of my favorite indications here is that open pores. I have like enlarged pore T-zone. I really find the fractional does such an incredible job on that. But something also really cool about seeing this list is I don't know if all audience members knew that they can use fractional both on the face and the body, which makes it even more versatile.
Yes, absolutely. That's a really good point. Yeah.
Amazing. All right. So just a little fun fact. I like to always throw a fun fact into everything we do. Talking about depth of penetration and re-epithelialization. So the epidermis is about as thick as a piece of paper. So I don't know if any of you who are joining us has joined our skin science webinar series, talking about, the skin biology and really looking at those layers of the skin, but it's quite thin, the epidermis, that's that top outermost layer. So we want to target this area to speed up that re-epithelialization, which means, our skin turnover, having those dead skin cells slough off so that we have newer cells always coming to that surface. So that turnover of cell renewal is really important for that skin rejuvenation, for that more youthful appearance, as well to remove damage, right? We want newer, healthier cells to the surface rather than the damaged, dull cells that sit at the surface. So in turn, the epidermis is about 100 microns. So we're going to be talking a little bit about microns here, and I just want to give you a little background. If you haven't ever used the term micron or that measurement, 1 micron is a 0.001 millimeters. So 100 microns is 0.1 millimeters. Therefore, 50 microns will penetrate through as much as half of the epidermis or layers of the stratum corneum. Thus, 1,000 microns is 1 millimeters in depth. So why are we looking at this? Well, I'll give you a comparison here. Something that's quite common. A lot of us are familiar with microdermabrasion. It's probably one of the most common types of treatments for sort of resurfacing or exfoliation. But when you look at what microdermabrasion does, it's literally a physical exfoliation. It's just on that outer surface of the skin. It's a physical. We're actually using diamond tips or crystals to actually remove those dead skin cells, but really it only travels 10 microns. So really it's only just that outer layer of the stratum corneum at 0.01 millimeters. With the micro laser peel, which is another term for getting a fractional skin resurfacing treatment, this will travel 20 to 50 microns. So we're looking at 0.02 millimeters to 0.05 millimeters, varying different areas of the face. We know certain areas of the face are thicker, some areas are thinner. And since the depth is halfway through the epidermis, the micro peel will result in looking at up to 500 microns of tissue being removed during the laser peel, because that's something Kate's going to go through with the treatment parameters, is how many layers you can or how many passes you can do. But that's, this here is just to show you that, depending on the different types of skin concerns and that you have and you're trying to treat for your patient, you may need to do multiple passes. You may need multiple treatments because the different types of skin concerns, skin indications vary in depth in the skin. Dermal pigmentation versus superficial pigmentation, where you might have an acne scar or post-inflammatory hyperpigmentation from acne, your fine lines and wrinkles, or are they deeper wrinkles? So you can see that we have more capability of treating more indications with a fractional skin resurfacing than just a regular exfoliation. So this is definitely beyond exfoliating or resurfacing just the outer layer of the skin. We're bringing new cells, we're treating more skin concerns that are in those deeper layers of the epidermis and dermis. So, Kate, we'll talk about this here, sort of just summing up when we look at the different types of indications that you mentioned. Now that they have a better understanding of the depths, in comparison to something very common like your microdermabrasion, please talk to them about, how many passes, how many treatments might be required here per indication.
Okay, so there's a couple things to consider first and foremost when it just comes to the basic parameters of using a fractional. Different skin types are going to require more or less treatments because with darker skin types, you got to be really careful with how many passes you're doing. Now, there's something about that we know if you've had any sharp light training and you've been to our courses or Skin 101 and things like that, you know that the darker the skin, the more melanocyte activity that we have, and it's easier for pigmentation to arise. And so when we get into our darker skin types, we have to be very careful about how many passes we're doing, because the more passes you do with a fractional, the less skin is reserved and safe, right? You have that controlled space. When I'm teaching, what I like to say is try to draw a hashtag on a piece of paper and then quickly try to draw another hashtag and another one and another one up to 4 times, because you can do a maximum of 4 passes depending on the area and the skin type. The more hashtags you draw, the less skin is reserved. And so that can lead to more heat-induced treatment and more inflammation, which can stimulate melanocyte activity and that enzyme, tyrosinase, which is what creates the pigmentation or makes your melanocytes start to react. So that being said, an acne treatment for a skin type 1, 2, 3, you might be able to be a little more aggressive in certain areas versus, treating an acne skin type for a 4 or a 5. So keep that in mind as I'm saying this. I just wanted to preface that. So essentially what we've done here is we've looked at what microns and where the depth is. So for acne scars, for example, up to 1 to 5 millimeters deep, several treatments will be necessary because, again, this is a deep tissue scar. So you're going to have multiple treatments in order to really address and improve the look of that scar. So one treatment probably isn't going to cut it for most acne scars. You're probably looking for a series of at least 3 to 4. And that being said, you have to look out for sensitivity and skin type as well. So you might have to do more treatments just to help you with the safety of the client and obviously avoiding complications. For enlarged pores, they're usually about 0.25 millimeters or 0.5 millimeters into the skin. So you're probably looking at about a 1 to 2 treatments to try to really start to see the improvement in those enlarged pores. It's also about building collagen and stuff too. It takes time for collagen to build. That in itself, it takes time for my hair to grow this long, my nails to grow, and skin is the same way. So we have to give that time period and those treatments time to actually build the proper collagen to help with the tightening. Pigmentation is said to be set about 0.2 millimeters to 1 millimeter depth in the skin. So you're looking at about 3 to 4 treatments with pigmentation. I would say probably more versus less treatments with pigment, because pigmentation can go quite deep into the skin. It can be affecting a lot of cells. And so this is why we need more treatments. And to err on the side of caution when you're dealing with different skin pigmentations, right? It's not a one size fits all with pigment. And we'll learn that a little bit more. And I think in some upcoming webinars, I'm sure. Tone and texture, this again, we're dealing with collagen and things like that. You can see improvements with one treatment with fractional. I've seen it happen. It's beautiful. People have a really good refresh look after one fractional, but if they have worse texture problems, it might take a little bit longer to see those results. Sun damage and sagging skin, again, it's still about collagen. We're dealing with pigmentation and stuff. So you're looking about 3 to 4 treatments to really begin to see those changes in the skin.
Amazing. This just really helps show, the deeper the damage or the longer the damage has been there, you might require more treatments, and every person varies. So that's awesome. Thanks for outlining that, Kate.
Okay, we also wanted to talk about the before treatment. So as I just had mentioned, and Monica's mentioned earlier, is that different skin types will require different, I guess, set of rules prior to doing fractional treatments. You have a little more versatility with your lighter skin types just to avoid pigmentation problems and stuff like that. I have treated, in the next slide, you'll see when we get there, is I've treated a skin type 5 for acne scarring. And what I did to kind of prevent pigmentation from forming as a result of the post-inflammatory hyperpigmentation is what I'm referring to. So when we caused a lot of heat in the skin and the skin has inflammation, and in order to stop the enzyme tyrosinase from causing that pigmentation occurrence to transform the melanocytes into darker pigments, I actually had her on something called a tyrosinase inhibitor. Sorry. So these tyrosinase, there's so many of them. This is just, I think I've got 5 here that I've picked out. And these are the ones that are very readily available. They're in a lot of skincare products. You don't need a high dosage or anything like that, but just regular usage will help to control and stop that post-inflammatory hyperpigmentation happening unnecessarily. That being said, you will still have some transient hyperpigmentation as a result of the peeling process in the skin, so don't be alarmed when you see that. But glycolic acid is a lot of people use that one. That one is you can use it in a toner. I recommend about a 7%. It's really good just to use on a daily basis, especially if you are prepping to have a fractional, or even just in your daily uses if you're having pigmentation issues. There's also alpha-arbutin. Alpha-arbutin is a derivative from a very commonly known hydroquinone product. Hydroquinone obviously has got a little bit of negative connotations of it in the industry. This is a stable derivative. It is very easy to use on a regular basis, and you don't have to worry about being on a prescription for alpha-arbutin. Azelaic acid, there's also resorcinol, and kojic acid, kojic acid is derived from mushrooms. So there are lots of choices. You can choose what's best for your particular client, and go from there.
And Kate, can you just quickly outline, if your clients are using this prior to a fractional treatment, how long should they be using it for? How long before the treatment should they discontinue if they have to? If you just do a quick overview of that.
Absolutely. So from my experience with these particular ones that I outlined, they're safe to use right up until the treatment, even right before the treatment. It's totally safe. You're fine to use the glycolic acid prior to. They're low percentages, so they're fine to use. As far as how long, the longer the better. If you can get them doing it for 2 weeks, 4 weeks, 6 weeks, get them on it right away. If they're coming in to see you, they've got pigmentation issues, you're treating them with laser on a regular basis, get them on these products. There's no harm in doing that. They can add it very easily to their routine, and it's going to benefit them.
Yeah, it's going to benefit them and you and your treatment outcome.
Yes.
So a great way to do that, and I'm glad Kate outlined that, because when you have a consultation with your client, this is the time. Get them on a tyrosinase inhibitor and book their treatment 4 to 4 weeks out so that they do have that time prepping their skin. And that's really going to be the key in the success of preventing that post-inflammatory hyperpigmentation in those darker skins. So that's really a key point here to remember and to kind of put into practice, right? So awesome.
All right, so this is the individual that I treated. She's skin type 5. She has deep acne scars from a while ago. She was even on Accutane, and she had it really bad. So what I wanted to outline here is the aftercare, and basically what to expect and how to talk through, right? When you're talking to your clients or patients prior to their treatment, it's important that they understand what their healing process will look like. They'll have, you're setting expectations and goals for your clients. And so this is what's going to help them understand the process. So they're not texting you every day being like, oh my God, this happened. Oh my God, this happened. So setting them up for,
why does my skin feel like orange peel?
Yeah, why is it so rough? What is this pigment? What's going on? I'm so scared. So this is a good conversation to have, because you can set the expectation, but also help them maneuver through it and support them. So usually on day 0, you're going to have pretty moderate to severe erythema and edema. I mean, sometimes really quite puffy. Really, I've seen, like, it looks like they've got swollen eyes, things like that. Obviously, if you're doing anywhere close to around the orbital bone and that sort of thing, you'll see definitely some swelling. You will feel like a sunburn. Okay, it's going to have that radiating, pulsing heat. It can be uncomfortable. Cool packs is your best friend. Keep using something. On day 0, I really recommend you're using cold compresses right before. When they're leaving, make sure that they leave with a cool compress if they have a long trip or it's hot outside, things like that. Keep the area clean and clear. I know that there's some people who like to use something post-treatment, like like an occlusive, so like a Vaseline or a Aquaphor or a Polysporin right directly after the treatment. In my experience, using this can be quite occlusive and actually trap the heat in the skin. So I actually don't recommend that you use anything post-treatment. As far as an occlusive, it has to be able to breathe properly. You want to avoid water-based products because, again, that's going to sting a lot and add a lot more heat to the skin, and your client's going to be uncomfortable. So cool compress, keep it simple, keep it clean. And then when they go to their car, make sure they're protecting themselves. If they have a hat or something like that, just to avoid direct sun exposure.
I think that's one of the biggest things, Kate, is everyone is always like, oh my God, there's so much heat. But it feels like a sunburn.
Yes.
Right immediately after. And it's a really important point that Kate's bringing up here. It's something we see all the time with the biggest question: what do I put on immediately after? And so Kate's recommendation, nothing, because you could trap that heat. Even water-based where it's cooling, you got to look at it like when you have a little, even tiny paper cut and you run your finger under water, what happens? It stings. So it's the same concept. If you put a water-based cooling product, it's going to sting more. So Kate's recommendation, what we train as, is nothing on the skin in that immediate post-care. And then Kate, you can continue on with, your 12 to 24 hours after.
Okay. So 12 to 24 hours after, you still might have some redness and swelling. You will start feeling that tightness because the hydration, like the water content in your skin has evaporated. So you're going to have that kind of tight feeling. That same tight feeling, like if you have like a carpet burn or a scrape, that feeling of just tightness, your skin is tight, it's irritated, that you'll feel that as well. We do recommend, if you can, I mean, not everybody can, which is why sometimes downtime can be hard for individuals, but to stay inside, avoid sunlight. You can use a gentle cleansing to kind of soothe the skin at all, like to, help clean, make sure that it's clean. And at this point, at this mark is when you can introduce your hydrating product or your occlusive hydrating barrier. So this is where you want to introduce Aquaphor. If you want to introduce a fragrant-free cream from the product line that you carry, just make sure that it doesn't have any active ingredient in it, that it's calm, soothing, hydrating base product. A lot of people will run to polysporin. I hear this a lot. If there's no sign of infection, you really shouldn't be putting polysporin on the skin. Polysporin does not only does it kill bad bacteria, but it kills good bacteria too. And so we can get a lot of irritation from just using polysporin just because. So try to avoid polysporin. If there are infections happening, they should probably go see a medical professional anyways. So that's what I recommend
Polysporin
there.
is meant to clean a wound.
Yes.
We are doing a controlled clean wound.
Correct.
So yeah.
Yeah.
Agreed.
Okay. For your 48 to 72 hours, so this is your 2 to 3 day post-treatment, you're definitely going to have some scabbing. You're going to start seeing that separation from the layers of the skin. So you will start seeing it, the skin that's going to shed is going to look darker. So this is what I call transient darkening. It doesn't last for very long, but if you can see, like even in my day 5 photo there, you can see that those spots are scabbed and they're pigmented. And that's normal to see. So don't be alarmed that that's transient, it'll go away. You can still continue to use your hydrating barrier cream. You want to be using SPF if you're going outside and protect your skin, and continue with the gentle cleansing. Keep your active ingredients away until those scabs and the skin is shedded properly. And then your 4 to 7, in your final days, like I said, this is a range just because if you have a more aggressive procedure, there's going to be more downtime, obviously. So that's why it's such a range from 4 to 7. It's a little bit of a broad number. There's going to be itchiness. That's probably the biggest complaint I get is my skin's so itchy. It's so itchy and, it's still flaking. You may still have scabs, transient darkening. Eventually those will slough off on their own. Do not scrub at them. Do not pick at them. That's the worst thing you can do for your skin right now. Just keep them hydrated, keep them clean, and protect your skin. And that's it. And then you'll have nice, clear skin. And treatment process, you probably book them fractional. You can do once a month, I would say, just because of the healing processes. But yeah, that's pretty much it.
And we love zinc oxide.
We do love zinc.
SPF.
Yes.
If you're looking at SPF options, go mineral. Zinc has those anti-inflammatory properties. So that one is often what we select at Sharp Light.
Yep.
Amazing. I think this is such an important portion of our training, and our retraining and our refresher. So yeah, any questions about this we can answer at the end. But very important information is the aftercare for fractional, because of all of our treatments, this would be our most downtime, but you can see it's minimal. You can still go to work, you can still carry on with your day, and look at the amazing results. I love these before and afters that you did, Kate. You can really see an amazing result there.
Okay, so fractional requires usually 1 to 6 treatment intervals that are spaced to 4 to 6 weeks apart. Total course can take up to 6 months. Obviously, if you're doing a treatment a month, you can continue to do these results as long as the patient or client is happy and moving forward. Like I said, this is also preventative too. So you can work with your tips and work with what you're using. As far as the fractional handpiece is concerned, you can even use these in stack treatments, which I think we'll talk about it towards the end of our presentation, just to talk about adding fractional to your business and talking about how you can improve your treatments that you're already doing. So yeah. So like I said, and I've been saying, you have treatment versatility with your fractional. You can do an radio frequency fractional treatment. If you're doing SR, you can add a fractional afterwards. If you're doing an RF and an SR, you can do fractional afterwards. Sharp Light is very known for their stack treatments. The more you stack it helps with the efficacy of the treatments, because you're treating multiple layers of the skin at the same time, building that heat, building the inflammation response, which in turn is going to give us an improved result on our skin overall. Our fractional handpiece right now has two tips, the 9x9 and the 7x7. You might be wondering, well, what's for what? So the 9x9 is your maintenance and preventative. So this spatial pattern is actually, it's smaller dots, but lots of them. So the smaller the dot, the faster the healing, right? If you're trying to heal a small dart, the skin is nice and close together, so it doesn't take as long for it to heal. So this can be used for refreshing first-time treatments. So if somebody's really nervous about fractional, they don't know what to expect, and they just want to kind of get a taste of it, 9x9 is a great place to start. You won't see too much correctiveness. You'll see some improvements, but obviously because of the less intensity of the controlled wounds, there's less heat, and so you're getting a little bit less of a overall improvement and obviously if you're dealing with more complicated, more farther down the line aging processes or issues, you need something a little more aggressive, which is why the 7x7 is here. 7x7 creates a larger wound. There's more heat infusion. There's more stimulation and inflammation post-treatment. There's a little more downtime because obviously the holes are larger. So there's less holes, but they're larger. And so more heat infusion, more resurfacing, more corrective. It's technically more aggressive. So if you are dealing with picking up scars or you're dealing with stretch marks or a lot of pigmentation, you might need to use a 7x7 just to kind of get the process going in treating the concern.
It's a great visual there because when we looked at the ablative versus non-ablative and the fractional ablative, which is what we're talking about, those larger holes, there's more ablation. But it's still fractionated, so there's still surrounding tissue intact. So that's what Kate's explaining. Like the more ablation, the more downtime, right? Or the more you're working on, right? Like a full ablation, you can remove most skin concerns, but that's what we don't want nowadays. We want less downtime. We want less risk and complications. So we have two options here, two great treatment options. They can be done, one starting out as a 9x9, as Kate said, with that sort of nervous client or that first time client. And then the next treatment maybe you're looking at the skin reacted really well, and maybe we want to get a little more aggressive with the second treatment for other concerns. So this is a great way of looking at how a treatment series can be very customized. And also when we go into stacking, because that's what we're going to talk about next quickly before the end of the webinar, is sort of that ROI, how we can incorporate fractional into stack treatments. As you said, Kate, this is a big sharp light advantage, is that we can stack our hand pieces, as we have a few here listed. We're going to highlight a couple treatments that we love our fractional with. But something I think you always say, Kate, when you get into stacked protocols, you want to kind of work with the 9x9 as well, because you've already added a lot of heat with working with RF before SR. So often we use the 9x9 at the end of or in a stack treatment. Whereas if you're really going 7x7, it's more of a when you're doing fractional alone. But perhaps there's times where you may use 7x7 in a stacked. Have you ever done that, or do you recommend always kind of leaning towards the 9x9?
Honestly, for first-time treatments, especially with stacked protocol, and you're introducing your client or patient to these a little more aggressive medical treatments, you might want to start with a 9x9 and see how the skin reacts. What I learn mostly about my patients and my clients is that it's kind of baby steps, right? And it's good to understand how their skin responds, so you kind of get a gut instinct on how they're going to heal. So I do recommend, at first 9x9, especially in the sensitive areas. Okay, if you're working on the face, around the eyes and things like that, 9x9 is best. There are times where I have a nice, like thick, oily, tight skin where 9x9 really isn't going to do much for them if I'm working on their acne scars. Even in a stacked treatment protocol, I will still incorporate my 7x7. But like I said, it's a client by client basis, and how you feel they're going to result best. And always test patch, right? You can do that too. You can definitely test patch, test the waters, see how it goes, and then make your decision from there.
Amazing. Awesome. Test patch, consultation, that skin consult, that skin analysis is super important.
Yes.
Amazing. So just to touch on, the advantage of your fractional handpiece in your practice, in your business, as well being able to go into stack treatments using your fractional. If you have other handpieces as well, sharp light handpieces. We always kind of start here as, when you look at basic spa services, when you aren't working with laser technology, of course, you can make some great revenue with your common treatments like your microneedling, your chemical peels, your microdermabrasion. But when you incorporate laser into your practice, you can see the increase. So sorry, I'm going to go back one and look at sort of like what that total is. You're looking at your $400, $500 range of treatment, of revenue per week, but your treatment prices are ranging around that $100, $200 mark. So, if for this example here, you can, make $2,400 a week. But as soon as you incorporate that laser technology, the price of your treatments go up to $300, $400, $500. If you're doing stack treatments, you're looking at, even some places charge around 800, because it's you're getting more results in one treatment, so you'll need less treatments. So people are willing to pay it. It may seem intimidating at first, but a lot of people want less treatments, but they want results quicker. And that's why stacked modalities are such a huge advantage in this industry right now. And why we really love to highlight them at Sharp Light, because that's what you get to do when you have a laser device, a multi-modality device, where you can incorporate multiple handpieces into one treatment. So you can see here, your revenue jumps up to $9,600 a week. When you're using fractional, and incorporating it into even stack treatments as well. So just to highlight a few stack treatments, because again, that's the beauty of Sharp Light, is these treatments that we can incorporate multiple hand pieces. We have our carbon facial here with our elite facial, or our elite skin treatment. You start with your carbon, and you then continue with our spot treatment, our VP dual. You can do your SR handpiece for skin rejuvenation, and then you finish with your fractional. So fractional is always at the end. Kate mentioned that it's always at the end of your stacked treatment protocols. But this is something you can learn in our advanced training. We have this available to you, but to give you a quick little overview of this treatment, we have a video here that you can watch to see how the stack treatment works with our fractional handpiece. This incredible client of ours loved her results. As you can see, that's 4 treatments in one treatment session. 4 of our hand pieces that, and she was on the more sensitive side as well, but you can see that you can offer these incredible customized treatments tailored to your client's needs, what they want to treat. She was concerned about her redness, her aging concerns, some of her sun damage, her fine lines and wrinkles. So that was something that we were able to deliver with this elite skin treatment. Something we want to mention here is our triforma, because Kate was talking about the eye area. And we do have a stack treatment where we can lift and tighten all areas of the face using our RF technology, our infrared. So we're kind of looking at like lifting, tightening from, the neck and chin up. And then we use the fractional around the eye area. So this is something you don't want to just jump into. It takes a lot of practice. You want to meet with one of our trainers for an advanced training to go through the eye treatment area with fractional. It is a thinner skin, so go back to all those microns and remembering that, you may need a less aggressive treatment, your 7x7 with less passes, but it's definitely doable, and the results are incredible. Kate mentioned swelling. That's very common, right, Kate, with the eye area.
Yes.
But again, we have options. It can be done just the fractional eye lift on its own. But this is a great stacked treatment where you kind of work in the whole face and that lifting and tightening. So again, I'm going to just play a little video here so you guys can see it in action. So this one doesn't have any music to it. So Kate, you can just, if you want to just do a quick.
Yeah, absolutely. So this is the RF face that we're using. So this is going to help. RF face is really great for not only contouring, but also the skin tightening. And what it does for this is it actually serves as a way to heat up the skin primarily and get that circulation going. So you'll use this. The machine itself will tell you how long to do each side of the face. And then it looks like we're going into the IR. So again, stacking that heat, right? So when you're mixing radio frequency and IR together, you're sandwiching the different layers of skin with this different styles of heat in that. So IR will go into the reticular dermis and stimulate the collagen that's there. It helps to strengthen the collagen there that's existing, but it also helps to stimulate new by creating that inflammation response. These procedures are also very comfortable. This feels like nothing because we have such an amazing cooling tip that helps to cool the layers of the tissue and allows the heat to go where it needs to go. We have a 3.4, this one's for the face, but we do have a 6.4 for the body as well. So if you are doing treatments on the body, you can do that too. And then, yeah, I think she's going in with the fractional now. And so Triforma has is treating mostly the area around the skin and lifting and doing the eye lift here, I believe. And so I believe she's using the 9x9 and going over crow's feet and helping to lift the skin around the eye. And you can go, like she's going, as long as you're not in the eye socket itself, you can go right underneath the brow. See how she's lifting and making sure that the area is going on the bone and not pulsing directly into the eye socket. And like Monica said, please book with a trainer to teach you how to do this. A video is not enough for you to kind of go off of. It would be really helpful for you to learn with your trainer.
Yeah, let's reemphasize that. I like that.
Yeah.
You can see
Yes.
she's still wearing goggles. We're not doing
Yes.
it without goggles. And even, you can see the technician here. If the handpiece doesn't fit in that area, you're not going to pulse there, right?
Yes.
So everybody's eye area is different shapes, different sizes. So yeah, definitely booking with your trainer for that.
Yes.
So the last stack treatment, just quickly, we don't have a video for this, but just a great one to highlight with our fractional, our hero of the day, is our refresh treatment, starting with the carbon, going back to microdermabrasion. Carbon facial is similar. It's just that superficial exfoliation. I love it better than microdermabrasion because it's not tugging on the skin. It's an incredible way to really remove that surface layer. And then you're going to get even better results with your fractional. So it's like you sweep before you mop sort of thing with this treatment. So another great way to really give that glow, give that refreshed skin, have that newer skin. You know, great before events as long as it's done a month or two in advance, because remember that healing time with the fractional. And just remember with any of these stack treatments, the intervals are going to be with the longer downtime handpiece. So you'll always do this in the intervals of a fractional because the fractional is involved and it requires that 4 to 6 weeks time between. So those are some of our highlights we wanted to mention today in terms of our stack treatments. I hope you all are feeling really excited about the possibilities. I know there's a couple questions in the Q&A, so we're going to answer those. And if you have any other questions, feel free to pop them in there before we go. But there's 2 here. From Ashley, I have the Rapid DBC. Can I add this one on the fractional, or is it a separate machine? So the fractional handpiece does not work with our Rapid DBC because it is a laser. So it is, you do need to be with an S4. We do have Rapid series that incorporate the fractional handpiece, but we do have upgrade programs. So if it's something you want to bring on, as you can see, you can continue with all of your DPC handpieces and bring on your fractional with an upgrade, and you're able to incorporate all those stack treatments as well. So it's not going to be a handpiece directly on your Rapid DPC, but there's definitely options for you in terms of our upgrade program. Great question, Ashley. Pavlina asked, and I know this came when you had the post-care up, Kate. Mm-hmm. Can I use Aquaphor or Vaseline right after the procedure? So let's just quickly re-answer that. You may have answered it during that slide, but yeah, she's wondering, can I use Aquaphor or Vaseline right after the procedure?
Okay, so post-procedure directly after day 0, we do not want to be using any occlusives. We don't want to trap the heat in there. We want the heat to be able to leave the skin to avoid complications, PIH, things like that, and we want the skin to be able to breathe properly. You can incorporate an Aquaphor, or if you want to use a Vaseline, you can use that, I would say on day 2 or 3, once the heat has subsided.
Amazing. Robin's asking, can you do HJM after fractional?
HJM.
Mm-hmm.
I don't know what HJM is. I apologize.
Maybe, Robin, if you can, if you can tell us what HJM is, and we'll answer the other question while you're putting that in there. Robin, can you spot treat the face, or should you do a full face treatment? Can you just do cheeks, and what would you charge if you can? So yeah, with fractional, can you spot treat?
Oh, hydrogel mask. Mm-hmm. Gotcha.
So now you can answer both.
Yeah. Okay. So as far as hydrogel mask, remember a lot of the issue with doing a fractional and then having, I'm not sure if it's a water-based, if it's water-based product, again, that's going to get into, it's going to be occlusive. I know hydrogel can be occlusive depending on which one you're using. And if it's water-based, it's going to cause a lot of stinging. And that's what I want to avoid. So this is why directly after, like I said, cool compresses are best. I wouldn't do a hydrogel mask post-treatment. I don't know if you know any different, Monica, but that's in my procedures. I've never used it post because I'm worried about the stinging sensation that happens and the occlusivity of it. Yeah.
Yeah, I know a lot of medical practitioners will use a collagen, straight up collagen, like avoiding like water-based masks. Again, because it's more occlusive, but it's temporary, like it and then you still want to release that heat. So they can remove the collagen mask and they can go home with nothing on the skin, as Kate had mentioned. So we kind of avoid the hydrogel masks. Often they're cooling. Just maybe they can come back in 2 weeks and you can do a light enzymatic exfoliation and do a hydrogel mask then. So that could be something to incorporate, in between your fractional treatments. A mini facial with an enzymatic exfoliation helps slough off some of that peeling skin, and do a hydrogel mask then. That's what I would recommend.
Okay. And then, I think the other question was about a spot treatment, right?
Yeah. So can you spot treat the face or should you always do a full face with the fractional?
That's a
That's our
great
last one.
question. And honestly, you can definitely do a spot treatment, especially if it's just like a pigmentation or if it's just a scar or something like that. If they can do the whole treatment and they're going to have the downtime anyway, you can even use the 7x7 to treat the problematic areas and use the 9x9 to kind of even out the rest of the skin. That's what I like to do. And that's actually what I did for my acne client that you saw. I used the 7x7 on her scars, but I used the 9x9 on the rest of the face because she's already paying for me to do the treatment and might as well, you know, do the whole thing. And she was willing to have the downtime and that sort of thing. As far as the cost for spot treatments, I'm not sure. Obviously, I think it would just depend on the area, that sort of thing. So I'm not really good to ask about prices. I don't know, Mon, if you have any insight to that.
Yeah, I think again, that's something we always say, talk to your TM about in terms of like demographic, your clientele. You know, it would all depend on the passes that you're doing and what you're charging for your full face. So we are at the hour here. There's a couple more questions here that we can, Kate, if we can answer in like 1 minute, and then
Yep.
we'll say no more questions so that we can end on time here. But Anonymous has asked, when do you talk about passes? Do you want when you talk about passes, do you want the grid to be layered directly on top of each other?
It would be impossible to do that. Just like I said, try to draw a hashtag on top of it without being really slow and careful. The idea is not to be, but if you're talking like passes, yes, you're going over the same area multiple times, and depending on the area, depending on the skin type and following our protocols, you can do 2 to 4 passes on the same area.
Awesome. And then Ashley, of course, if you've never done fractional before, if you're, I think you were the one with the DPC machine and you're like, hey, maybe I do want to incorporate, you know, a new device so that I have a fractional handpiece. You can always come in for a demo for it. So please, if either reach out to your TM or send SharpCare an email, sharpcare@sharplight.com, and we can set that up for you, get you sorted so that you can see it in action, feel it, if that's something you want to upgrade to. So I love that you're interested in it. I love that you guys are excited. You know, it's a great treatment. We love it. Again, it's one of the most advanced treatments and in demand treatments right now in the industry. So we're glad we were able to bring more insight to you. Thank you so much for your time today. I thought it was a great webinar with lots of great questions and really important points that we were able to take you through for, you know, pre-care, post-care, and what really is the advantage of fractional skin resurfacing. So thank you, Kate, for all your insights, all your invaluable information. And I'm excited to bring more, you know, in-depth knowledge to everybody on our fractional because it's such a great treatment, but we need to handle it with care and expertise. So that's what these webinars are for. We want to bring you more information and the opportunity to ask great questions. So thank you all for your time today, and enjoy the rest of your Tuesday.
Thanks, everyone. See you soon.
Bye, everyone. Thanks, Kate.